Hi everyone, this is my first video blog, and I decided to do a video blog because I am about to have rhinoplasty surgery tomorrow, and it's something I've wanted to do for a very long time. It's something I'm really looking forward to. It's something I've always wanted to do, and that's my cat. Say hi, Pishi. Say hi. Anyhow, it's finally happening for me, and it's happening tomorrow, and I'm super excited because this is just something I've always wanted, and it just kind of worked out. I found the right surgeon, and it's the right time in my life, and I'm just gonna go for it. So here's my nose beforehand. The side, underneath, from above, and that's my nose. I pretty much, before tomorrow, I had 2 other appointments. One was for initial consultation, where the surgeon looked at my nose, took some pictures, went over like what his thoughts were regarding, you know, how things are going to turn out, what my realistic expectations should be. Like, you can't just, you know, go get rhinoplasty and say, hey, make me look like Kim Kardashian or make me look like Jennifer Lopez. You can't just do that. You have to have your nose looked at, have your bone structure looked at, and see what is in the realm of possibilities for you. So based on my bone structure, he's going to try to narrow this area, the bridge of my nose, a little bit. He said that mine is quite wide when they, you know, take like aesthetic measurements. And of course take the hump down, and as a result, this little tip, if you look when I smile, it goes down. That's really like unaesthetic. The tip of my nose going down is unaesthetic. Here, I'll do it again. And he's gonna try to kind of lift it up a hair for me so that when I smile it doesn't poke down. There's just some aesthetic guidelines that they use in reference to your face, and a trained surgeon should be able to look at you and say, hey, you know, this is your bone structure, this is your face, and these are my realistic expectations for you. This is what, you know, you should expect. I don't have any makeup on tonight, so you can see all my under eye bags, and the poor lighting here makes everything look even worse. And you can just, you know, I just really wanted to, I usually contour my nose so that it looks a lot smaller, but today I just decided to just be out here raw and honest, and kind of show you what the structure of my nose looks like before the surgery. So I had my initial consultation with him, and then I had a 2-week pre-op consultation with him where I was allowed to, you know, ask some questions regarding, you know, what to expect, what to do before the surgery. Basically, there's a lot of like strange things, like I can't have any kind of flaxseed, I can't have any kind of NSAID, which is like a non-steroidal anti-inflammatory, kind of like ibuprofen or naproxen. I have to stay away from things like that because that kind of stuff affects my clotting and my bleeding. Anything that, you know, is going to affect clotting, I have to stay away from. There were some things like I couldn't even, he didn't want me to use any kind of multivitamin. There's just like a bunch of things. He's like, you know, stay away from these things before your surgery. Of course, no alcohol, no anything like that if you're a drinker. Just all this stuff, anything that can affect the bleeding is going to affect the surgery, and he doesn't want anything like that. And basically, I've kind of not had anything like that for the past 2 weeks. I've just kind of, kept a pretty simple diet, stayed away from most medications, no kind of nasal decongestions, nothing. I just kind of stayed away from all of that. So hopefully I'll heal really well. And then he gave me a bunch of prescriptions for things that I need to pick up in order to help me, like, after the procedure, just kind of recover. And that includes like antibiotics. Actually, I have to start my antibiotics like tonight. And then I think tomorrow, there's some medicine I have to take tonight, and then tomorrow before the surgery, like 15 minutes before the surgery, what's going to happen is, or 15 minutes before I leave for the surgery, I have to take like an antiemetic, which is like something that'll kind of calm my stomach down so I don't get sick from the sedation, and just I think an antibiotic as well. So that's what he has me taking, and he reviewed all that stuff with me at my 2-week pre-op. Tomorrow morning, I'm going to get there. Tonight, first of all, he wants me to wash my hair and my face with Dial soap, nothing else, no lotion. And then tomorrow morning, I have to take another shower and wash my entire face and wash my hair again with Dial soap. Not very excited about that. It's winter here and it's gonna be kind of dry. I'm gonna show up looking pretty crazy. But I guess, he just wants no kind of perfume or makeup or anything that's gonna get in the way of, maintaining like a pretty clean field for his surgery. Other than that, tomorrow morning, when I get there, the first thing we're going to do is a urine test. He always does this on all his female patients who can possibly be pregnant, just to make sure you're not pregnant, which I'm not worried about. Other than that, when I go in tomorrow, a really cool thing about my surgery. So when you're looking to have rhinoplasty, it's really important you do your research on the different surgeons. My surgeon in particular, Dr. Nyack, I loved him and I picked him because, number one, this is his favorite procedure, and rule of thumb, nothing is your favorite unless you're pretty good at it. You just tend to love things that you're good at, and he really loves rhinoplasty, and he's known for rhinoplasty, and he's very good at it. So I picked him because of his passion for it. I really liked some of his examples of his previous surgeries. Always take a look and see if you like the style of that surgeon. See if you kind of like it's. There's so much of it that's based on anatomy, but there's some of it that is truly an art, and you have to pick a surgeon that you feel that has your same vision, has like the same, like some surgeons, for example, that I looked at, all their noses kind of looked super pointy. Everything was kind of pointy, and I guess in their eye that was beautiful. Dr. Nyack's was hit home for me because all of his surgeries, in my opinion, were beautifully done, very tastefully done, very proportional. There wasn't anything too extreme. And all of his surgeries that I saw, the before and afters were very desirable and very beautiful. And he even allowed for me to meet one of his patients when I was there for my initial consultation, and showed me her before, and I spoke with her and she was very pleased. So I did a lot of research on different surgeons. Another reason that I chose Dr. Nyack was because he's trained as an ENT, which is an ear, nose, throat doctor, and then he also did plastic. So he's kind of like dual certified. He's not just, he's got education in both areas. He's not just a plastic surgeon. He's a plastic surgeon and he's an ENT. That means he understands the anatomy that much better. He understands the importance of being able to breathe out of your nose that much better. Because in my research, I found that some patients after the rhinoplasty can't breathe, and I didn't want that. I wanted to have I wanted my nose to be functional and beautiful. So again, like for me, he was the one because I liked his style and because I just loved his credentials. He was, you know, both ENT and plastics. Really liked his office, and another reason I chose him it was because he's the only surgeon I spoke with who actually performed this surgery under IV sedation. So there's a big difference with IV sedation and general anesthesia. In IV sedation, well, I should say in general anesthesia, you are knocked out cold. You are, you know, right there next to death. Your body is just completely shut off. Your heart and your lungs and stuff still work, but you are like very close to like nothing working, and that kind of scared me. There's always more risk with general anesthesia, but they do perform most major surgeries under general anesthesia. You have to do that. You are completely knocked out. Any kind of heart surgery, lung surgery, major surgery like in the hospital, you're going to be under general. I just didn't really want to do that for my nose. This is cosmetic surgery, and I just kind of didn't feel the need to put myself at that much risk and deal with potential complications just for beauty. So I was really pleased when Dr. Nyack told me, hey, I do all my rhinoplasties under IV sedation. Another thing that I really liked about him is that he does all his surgeries in his office. He has a surgery suite, and he performs his surgeries there. So I'm not in a hospital setting. You know, working in a hospital setting, I'm really aware of kind of the pluses and minuses of that. And because this was an aesthetic procedure, it was something that could be controlled outside of a hospital setting, I really preferred to be in someone's private practice. Kind of like in Nip Tuck, where they perform all their cosmetic surgeries in their office. Dr. Nyack also does the same thing, which was a huge plus for me. Another thing that I really liked about Dr. Nyack, and you really should speak with your plastic surgeon, is whether or not they do packing. Packing means that a lot of times after surgery, what they do is inside the cavity, so anywhere, you know, inside your nostrils, they'll stuff it with gauze, like tons and tons of gauze. Like there is no room to breathe. You're like a mummy that's stuffed with gauze. They will just pull out that gauze and it just keeps coming. Basically what that does is it helps you kind of heal. It helps you have pressure against your tissues. It helps you kind of not bleed all over the place. I really like that Dr. Nyack didn't do that, because his technique and the fact that he uses the IV sedation, he will let me go home without all that packing in there. And as a patient, it's much more comfortable to not have all that packing in your nose for a whole entire week, where you can't breathe out of your nose and you feel like your nose is this big and it's so stuffed. He doesn't do that. He doesn't do packing. So recovery time and patient comfort is going to be a lot better. And then another thing that I'm expecting to have after my surgery tomorrow morning is I'm expecting to come home and I'm going to have something, you know, just kind of like a Band-Aid over top of my nose. It's going to kind of cover my nose, and I have to keep that on for a week. And then at the end of that week, I go in and he removes the packing, the Band-Aid on top of my nose. It's like a firm like piece of plastic that he molds to the shape of your nose, and it's really there to kind of protect your nose. It's not really there to like hold it in place or anything. Just a week is like very sensitive time, and he wants my nose kind of protected. If I'm outside, if I'm doing anything, kind of protected. Expected recovery time, he said like I should be kind of like in pain and stuff for about a day, but because he doesn't do the packing and he doesn't do the general anesthesia, my recovery time is going to be a lot quicker and I'm going to be a lot more comfortable. So I'm going to get up and come out and be ready to go. I realized I didn't go over the IV sedation. So I told you that general anesthesia has you like pretty knocked out. IV sedation is a lot more lax. It's a lot less sedation. So basically, I'm not going to remember any of it, but I will be responsive. So he'll, if he says, "Hey Oz, are you feeling okay?" I might respond to him and be like, "Yeah." Or I might say something funny that I'll regret later. Basically, I'm still responding to him. So, you know, as long as he'll probably put me on IV so I don't remember it, and but I'm still responding. If he needs me to turn my head and stuff, I can do that. But I won't feel anything because he'll probably inject me with anesthetics, and I shouldn't really feel anything if I'm, you know, completely numb. And if he doesn't get me numb, then, you know, I still won't remember it, but I might go, "Ow, that hurts." Or I might go, "Ugh," you know, groan a little bit or whatever. So he'll have like some response from me. But again, I'm in like this. They can knock you out like this, and they can wake you up like this. And that is the beauty of IV sedation. It's not as dangerous, and it's got way less potential complications than having general anesthesia. So no like recovery time. Sometimes with general anesthesia, you need like hours of recovery time. You're completely groggy and knocked out, and you're extremely nauseous. IV sedation is just like wham bam, you know, done. You're good to go. Just have someone drive you home because you're still kind of groggy. So anyways, that's basically it. I am gonna go pick my mom up from the airport. She's here to drive me home and be my nurse for a few days. But yeah, I'm gonna pick her up. We'll probably grab a small bite to eat, and then I'm gonna shower with the Dial soap and wash my face and wash my hair and see what medications I need to take tomorrow morning and put those aside, and then just make sure I'm wearing a button-down shirt tomorrow so that if they need to like access anything, they can quickly access it. They don't have to rip my clothes. Other than that, that's it. I'm excited. This is something I've really looked forward to, and I will follow up with you guys after my surgery if I'm up for it. But I'll definitely do a little video of me with the bandage on so you have an idea. And I'll try to have better lighting. This is terrible. But yeah, stay tuned. And again, this is the last view of my nose. This is from the side. This is me smiling. You can see the tip go down. This is from the top, me smiling. This is from the bottom, angulation. That's everything. Woo. And that's a wrap. I'll follow up with you guys soon. Wish me luck.